Hello and welcome to our webinar on healthy living and placemaking, where we'll be looking at how place can best support Scotland's health and wellbeing. I'm Irene Buteman. I'm the Planning for Place Programme Manager at the Improvement Service, and I have Matt Lowther here with me today. Hi Matt.
Hi, morning everyone.
Matt is Head of Place and Equity at NHS Health Scotland, and we shall be doing a double act of talking about this issue today. We also have Trevor Moffat here from the Improvement Service, who's facilitating this session, and I'll just pass over to Trevor to explain a little bit about questions and so on. Trevor?
Good morning everyone. Just with regards to questions, we asked people to send in questions in advance, and we do have a list of those. But if there's anything else you wish to address throughout the presentation, please use the box on the right-hand side of your screen. There should be an option called questions. Just make that pop up, and if you want to type in anything there that you want to ask, we will address that throughout the session today. If you have any issues with sounds or visuals, please also use that box, and I'll be monitoring that throughout. And I'll just pass you back to Irene and Matt.
Okay, thank you very much. So today, what we shall do, I can't get it to click through. Just bear with us. What I'll be covering is we'll really be splitting our webinar into three broad areas. We'll be looking initially about why we are working together and looking at the role of place in supporting health, what's happening in Scotland at the moment that makes it such an important time for us to be coming together. And who of us have come together and are doing a bit of work. Then I shall pass over to my colleague Matt Lowther, and he'll explain a little bit more about what's happening within public health at the moment, and go in a little bit more into how could we be forging closer links in this really important area for Scotland. Then the conversation will pass back to myself, and I'll have a look at those high-level areas of where we actually feel place impacts on public health and the behaviour of ourselves and our communities to enable them to live healthier lives. So, to start with then, looking at the why are we here having this conversation and why have some of us pulled together to work around this area. Just to be clear, what we're looking at today is about the way that we shape a place and how it can have an impact on behaviour of the people that use that place for the good or ill of their public health. This is about promoting healthy lives and promoting people to live longer, healthier lives, rather than that NHS treatment of people once they are already ill. It's very much about that kind of list of topics down the centre column there, and that's what I shall come on to and talk about in a bit more detail in the third part of this presentation. But it's just remembering that if we look at how we influence behaviour and the daily choices that we're all making, place impacts on that all the time. Many other parts impact on that as well. How we've grown up, where we've grown up, nature, nurture, but place is one of those elements that determines how we behave and then how healthy we are as a result. So in Scotland at the moment, there's a context that really pulls this together and makes for a really good time to be thinking about this and to be shaping the role of place in promoting better health. In the planning context, that stems from the fact that we had a Planning Act agreed at the end of last year, and it introduced three new areas where health is being promoted for its role within what planning can be doing. The first is that we will have a review of the National Planning Framework, and the Act specifically now says that it needs to think about 6 broad outcomes, but two of those are about improving health and wellbeing, and a further one is about improving equality within Scotland. Previous national planning frameworks have had an emphasis on delivering growth, be that inclusive growth, sustainable growth. This is a change because there are a broader set of outcomes now, and health and wellbeing is established there as one of the aspects that it needs to look at. The Act also introduced a need for the local development plans across Scotland to take account of the effect of development on health, and it's also asked that in future, before planning permission is given, that there is an assessment taken of the impact of that proposed development on health as well. So that's all going to be coming forward in the future. The national planning framework is happening, and the consultation on that is happening now, with a call for ideas. The other parts will come through in secondary legislation. That planning framework has to align with bigger world aims and countrywide aims for Scotland as well. So we have sustainable development goals with goals around health and cities, and what our aspirations are in world policy. And then aligning in that in Scotland, we have the national outcomes as well that set general aims for the well-being of people, as well as the delivery of inclusive and economic growth. So there's a bigger context that all of this sits within for planning and how it is shaping. There's an even bigger context, obviously, around the fact that whatever we do to promote places for good health also impacts on reducing carbon emissions, and that's an issue for Scotland at the moment, as we know, with the net zero emissions target having an impact on everybody's everyday life and needing changes in how we travel, how we keep warm, and how we design our towns and cities, and that's been highlighted by Scottish Government, those words on that slide there. Also, when we look at well-being, I would encourage you, if you haven't already, to have a look at Nicola Sturgeon's TED Talk on this topic, where the objective for Scotland is about a collective well-being rather than a growth at any cost. So there's a change and a tide about putting well-being at the heart of everything that we do. And that's the overall context in which we're moving through what we've had previously, where there have been research and evidence that have made this kind of observation that obesity, inactivity, depression haven't just happened. We've been legislating and planning for it, and that there's a need to make a change, stop an emphasis on purely growth and make sure that it's very well balanced with well-being and judging the success of our country. So that's the planning context, but obviously, as I was saying, there's a public health reform context going on at the moment, and my colleague Matt is going to run through those areas that are shown there on the bottom right hand side of your screen. What we've been doing in Scotland at the moment is looking at the fact that while there's a time to pull things together, the research is suggesting that while planning has always been about promoting public health, it perhaps hasn't always been doing that. Our colleagues in England suggest that without some consistent things to work around, that there is literally a lack of consistency into how councils are addressing it. And our planning colleagues have told us of a lack of confidence in applying the kinds of policies that exist in local development plan policies across Scotland to support public health, but perhaps are not being always applied over and above other priorities at times. There's also a disconnect, we're being told about, between planning and health professionals getting together and knowing who to contact and who to talk to when they have shared ambitions around the same themes. So a group of us have been working together, and they're listed down there on the right hand side column, and really what we're going to share now is a little bit more on how we feel we could be working together, what's happening within public health reform, because I've already explained what's happening within planning that puts the time right for us to work together, and then also we'll have a look at what are the high level areas that we feel we could be working together around. So for now I'll pass over to Matt Lowther, who will tell us a little bit more about the health reform and how we feel we could be working together more closely.
Thanks, Irene, and good morning, everyone. As Irene said, my name is Matt Lowther. I'm the Head of Place and Equity at NHS Health Scotland. So as Irene said, I'm going to cover two things really. So say a little bit about the reform process, the public health reform process that's been happening in Scotland for the last few years. And then, I guess, from a public health perspective, talk a little bit about some of the opportunities that Irene's touched on already, about the opportunities for how planning and health can come together and collaborate better. So public health reform, well, I suppose the first question really is why are we reforming public health? So we've been going through a fairly rigorous process for the last 4 or 5 years. And I guess there's 3 key drivers behind the reason for that reform. So if you look to the top left of the screen, you'll see the graph that says Scotland's poor relative health record. What that shows is life expectancy for a whole range of European countries going back to the last 20 or 30 years or so. And you'll see the good news, generally life expectancy has been improving across all of those countries. The bad news for Scotland, as you can see, the red line is that Scotland is at the bottom of those countries. And if you look towards the right-hand side, you'll see the gap between Scotland and those other countries is widening. So I guess despite our best efforts, and there has been a lot of effort put into public health over the last 10, 15, 20 years, it's right at the top of the government's agenda. Everybody recognises that there's a need that we need to be better. But despite all of those efforts, clearly something is not right, given Scotland's relatively poor record compared to other comparable countries. The second driver is around health inequality. So if you look towards the bottom left of the screen, so health inequalities are the unfair and avoidable differences in health outcomes across a range of different groups. And Scotland has some of, if not the widest health inequalities in Europe, if not the world. So that's a key aim for government, is actually narrowing those health inequalities. And the third driver around reform, I guess, is just a recognition that at the moment there are significant pressures on our health and social care services. Some would say unsustainable pressures. We have an ageing population. The cost of health care and health technologies is increasing. So there's just a recognition that we need to get much better, much more effective at preventing ill health in populations. And that's essentially the role of public health. So that's the reason why the government have chosen to reform the public health system. So it undertook a fairly significant public health reform review back in 2016. And as I'm sure as you can imagine, there were lots of recommendations coming out of that. But I just wanted to highlight three of the key recommendations. So the first was around creating a new national public health body. The second was a focus on whole systems working. And the third, the establishment of some new national public health priorities for Scotland. And I'll say a little bit more about each of those. So in terms of Public Health Scotland, a new national public health agency, some of you may well be aware that public health has three domains, and I've highlighted them there. So there's a domain around health protection, which is fairly self-explanatory. So the focus of that is protecting the population from threats to our health. So for example, environmental or biological threats such as food poisoning and radiation. The coronavirus is a really good example of health protection. So our health protection service in Scotland is rolling out measures to protect us from that. There's a domain of public health focused on health improvement. So that's much more about how we prevent ill health in populations and how we promote positive health in populations. And then there's a third domain of public health called healthcare public health. And that's really around how we design our health services to make sure they're effective, efficient and equitable. And currently in Scotland, the roles or the responsibilities for each of those domains of public health sit in different bits of the NHS. So what you can see on the screen now is basically how the NHS is structured in Scotland. So there's a number of regional or territorial health boards who have a responsibility to deliver local health services like primary and secondary care. But there's also a number of what we call special or national NHS boards, and they've got more of a national remit. And two of those, Health Scotland and NSS, National Services Scotland, have the remit for health improvement, that's Health Scotland, and health protection and healthcare public health essentially sit within NSS. So at the moment, the responsibility for public health is across a number of national agencies. So as of the 1st of April, those agencies are going to come together to form one national public health agency called Public Health Scotland. And crucially, for the first time, that new agency will be jointly accountable to both government and to COSLA. and I think, and colleagues agree, I think that's a significant change, because what it recognises is that the drivers of health sit way outside, or the drivers of public health sit way outside the NHS. So we need to get much better at working with colleagues right across the system, including local government, to really address what we would call the fundamental causes of poor health and health inequality, so the social determinants. So things like education, employment, place, etc. These are all the fundamental things that drive health, and as I say, they lie way outside the NHS. So for that reason, that's why we're much closer aligned to COSRA and local government. So the new agency has a number of aspirations, and you can read them through there on the screen. I suppose the key one, as I've been describing, is that there's definitely a desire for the new organisation to be much better at supporting delivery of local services. So working much more closely with local government, with local public health teams, with local communities themselves. So a much greater focus on how we support local delivery of public health. Obviously, the new organisation has not yet been established, so the detail of that still needs to be worked through, but certainly that's an aspiration, and certainly something the government are really keen that we do. And indeed, our new Chief Exec is Angela Leach. Angela was Chief Exec of East Lothian Council. So again, Angela brings that wealth of expertise about what, how we can better engage and support local authorities. So the second key recommendation was around something called whole systems working. So I won't go into detail about that. Apologies for the very complicated slide, but I guess this is just to recognise that a lot of the public health challenges we face are very complicated and very challenging. So in order to address those, we need to work across the whole system with a whole range of organisations. And there isn't a single simple solution. So the aspiration again is to be much better at working collectively together around some shared outcomes and priorities. Which brings us neatly on to the third recommendation in the public health review, and that was around the creation of a small number of public health priorities for Scotland. I think there was a recognition that each organisation or each bit of the system was focusing on their own priorities, and we weren't particularly good at coming together around joint priorities. So that's the whole idea of these national priorities. You can read them there. I guess there's no huge surprises. These were based on the best available evidence and a fairly rigorous consultation process to identify these 6 public health priorities. I guess the one that's most relevant to us and today is the first one, Scotland where we live in vibrant, healthy and safe places and communities. And it's great, for the first time, this is actually recognising that place and the environment is absolutely crucial, fundamental to health and health inequalities. So we were really pleased to see that as a key priority. So I won't say much more about the public health reform process. There is a website, and I've shared the details on the screen, so please go in and have a look. You'll find a wealth of information on that website. I just want to quickly just move on to some the opportunities around planning and health, and Irene's already touched on a few of these, so I won't go through them in detail. But I guess from our perspective, a public health perspective, we were really pleased and actually really excited to see some of the opportunities coming through the planning reform. So as Irene said, NPF4 is currently up for review. And the focus, one of the key level objectives, as Irene said, is to improve health and wellbeing of Scotland. So there's really an opportunity there for us in public health to work closely with government and others who are helping to develop this policy to make sure that it's done in a way that achieves those outcomes. Again, as Irene said, big opportunity around development plans and the requirement that they need to take account of the health needs of the population. So again, public health's role in that could be assisting the local planning authorities produce the LDPs, and potentially be a statutory consultee for each LDP. Health impact assessments, again, as Irene said, the Act was introduced a requirement for all national and major developments to have a health impact assessment. So this is something that we in public health obviously have led on and lead on. So again, we can help design the guidance, and we potentially could help local planning authorities assess and implement those impact assessments. There's also an opportunity to think around helping to support the training of elected members. So again, I think there was a requirement in the Act that all elected members receive relevant training. So we could work with our colleagues and our partners and other agencies to help support and deliver that training to make sure public health is embedded within that. And then I think there are a number of other opportunities. I don't have time to go into detail today, but obviously the Act requires statutory requirement for all local authorities to produce open space strategies. There's obviously the creation of new place plans, so lots of opportunities there around public health. So that's really me. I'm going to pass back to Irene. But I just want to conclude by saying I think it's a really exciting opportunity. As Irene said, public health is reforming, planning is reforming, so just so many opportunities there. Irene.
Lovely, thank you. So that's the work that we've been doing, the conversations that we've been having and talking to those working in public health and planning. We've pulled together where those opportunities now sit for us to be moving forward with now. But around what are the areas that we feel we should be looking at when we're deciding how do we come together, what topics, what are the determinants around what makes for a healthy place. So yes, they're social, environmental, economic, and we need to look at actually identifying them in order to maximise their impact, that there are policies out there being implemented that deliver healthier places on the ground and that make that shift towards the prevention of people becoming ill. So our group has spent some time having a look at what are those high level things that I listed very early on in the webinar, and we didn't have to look far. There's a lot of evidence and research out there. World Health Organization, Public Health England have done a lot of work, and Town and Country Planning Association have as well. And the same recurring themes were coming through about the need for healthy air and water, access to green space, good quality green space that is, not a strip of land down the side of a road, the impact that has on reducing mental health in children if they have access to green space before the age of 10, then they're 60% less likely to have mental health issues as an adult. Moving through those topics, good quality housing and good quality neighbourhoods that allows a community to build and that people are happy to walk out their door and to start to get to know their neighbours. Middle left, provision of good play facilities, not just for children and toddlers, but for teenagers, for adults, something to walk to get them active without having to pay for gyms and the like. And then centre there is a crucial one, is about the ability to create places where people can move around by walking and cycling, especially in those short journeys that take up the majority of car journeys that are polluting and causing carbon emissions within Scotland as well. How do we create places that enable that from the minute people step out their door? Paths for All, done a lot of work on that it has to be from the minute you walk out that door. Middle right there is the fact about the need to have access to local amenities, be that shops, doctors, schools, having things walkable that people have a thing then to walk to and a destination. Bottom left is that public space, places for people to meet and to talk that is quiet enough for them to hold markets in, to hold festivals in, creating those kind of places that also then start a sense of identity and belonging for a community when they go and attend these sorts of cultural events as well. And then another sort of final one, and these are very high level, is about that access to public transport. So the bottom there and the bottom on the right hand side is about we can't walk and cycle to everything, but can we walk and cycle to access to public transport to get to those bigger ticket sort of destinations such as be that retail, be that employment, can we get there without the need to buy a car or to buy the second car, and to contribute to carbon emissions and to costs to families as well. So these were the kind of high level things, and I've put them in writing as well for people wanting to look at this presentation on catch up. Those are the kind of high level topics that were coming through to us, but we knew that what we needed was something for Scotland. So as we sat looking through that, it started to dawn on us that really Scotland actually has already looked at this kind of evidence for Scotland and come up with a set of themes that creates the kind of place that enables good health. And that was the themes that are already sitting there within the place standard. The standard has been used as a tool for engaging with communities for a number of years now, but those high-level themes were echoed and reflected in what we were looking at beyond the UK, beyond Scotland, into the UK and into the world. So our feeling now with these 14 themes is really, why would we not use them? And that's really where we are, is we don't want to come up with a different set of themes that are in any way confusing, beyond the fact that this is a set that have been already used and used to ask communities what they think about their place. And when we get into those areas about social interaction and identity and belonging, it's the places that we create that start to enable all of those more kind of feeling and impact on human behaviour themes as well, of feeling safe and people caring about their place and having a sense of control and influence over it as well. So they came out of evidence on how to reduce inequalities, health inequalities predominantly. So we're sticking with those at the moment, and we're doing a bit more conversation around those to sense check them with others as well. And I'd encourage you all to have a bit of a sense check yourself on whether you feel that they suit, not just as a means to have a conversation about a place, but as a means to decide what should a place be aspiring to in order to deliver better health for the people who use it. Tracking just one of them through very quickly, that first one around moving around and seeing how it flows through and impacts on health, is if you were to look at the change that you can make in a place around cycling and walking infrastructure, then the impact on behaviour is to increase physical activity, interaction with nature, social engagement, and to bring down travel costs. That contributes, as Matt was saying, to that high level public health priority around place, but it actually contributes to all of the public health priorities that have been identified. Increasing physical activity, helping with mental well-being through access to nature and social interaction. If you're walking and getting to local schools, then it's helping children in their early years. It can reduce poverty through travel costs. And if you're helping with well-being, then you're also helping with substance abuse as well, as it's one of those things that can lead through into substance abuse, as can poverty. And then tracking that the whole way through to the health outcomes, that can be leading to a reduction in obesity levels, heart disease, type 2 diabetes, stroke, some cancers, and an increase in mental well-being. So that's just one of the themes, and as you can see, there are other themes that could be tracked across there to see the direct link of cause and that have been evidenced and researched. So the arguments and the moment and the opportunity for us to join up are very evident for us, and that's why we see these as being the most helpful themes at the moment for us to do that. We'll continue on with our journey, looking to what the world are doing, what the World Health Organisation, what Public Health England and Wales are up to, and looking for these Scottish high-level principles. We'll be feeding into Scottish Government with the review of the planning, following on from the Planning Act, and up there in the top right is the website where you can read an awful lot more about the National Planning Framework 4 and all of the change that's happening in planning at the moment, and indeed in the future for us, this is about joining folks together, looking at the role of having public health as a consultee. Will that help to join people together? How do we get planners, community planners, and public health practitioners in the room together and talking to each other and then working together as well? And we'll be continuing with that theme around the place standard tool, because we see it as being an important one. As I say, it's already been established. We have a wealth of information gathered from communities across Scotland about what they think of their place, on what they think of those themes in their place and how important they are. So that, again, is just me capturing in words what I've shown in images and highlighting for ourselves where, as a group, we're going next. We're looking at that remit for Public Health Scotland. We're looking at the National Planning Framework. We're looking at research and evidence about what kind of wording needs to go into that planning framework. And I urge you all to do the same. Is this something that we should be doing, or is this something that we must be doing? And some of the recent research really highlights that without it being a must, it may not get through into actual action on the ground. And then there's early work going on around the whole systems and the working together. And I encourage anybody working in planning and community planning and public health to be finding out if there's an early adopter in their area and seeing the role of place in progressing that early adopter and starting to make those links now. So we're on a journey. We hope this starts, if you're on a journey, it helps you, or it starts you off on one. And if all that it starts you onto is a journey to go and comment on the National Planning Framework, then that's a really good start. For ourselves today, we will be giving you further updates along the road as we progress. But thank you for listening. And what we will do is we'll go on to some of the questions that came through when you signed up. And we've identified a few of those to answer. And then at the same time, if you have questions, please be typing them in, and Trevor will feed them in as and when they're coming through. Matt, I think you had a question that you felt you could address at the moment.
Yeah, so there was a really interesting, great question around inequalities and how the inequality gap can be reduced through planning. As I say, that it's a great question, but it's quite a complicated answer. So I suppose it's important to consider what causes inequalities in the first place. So we at Health Scotland have developed this thing called the theory of causation. I won't bore you with all the details of that, but basically that is based on the idea that health inequalities are caused by what we call these fundamental causes. So these are things that happen, I guess, at a national or a global level, and they affect how countries essentially choose to use their wealth and the resources that they have. So, for example, how a country chooses to raise money through taxation, how it chooses to spend that money through the welfare system, etc., etc. So these things, I guess, kind of influence the circumstances in which people live. And so, for example, we know that living in a nice place with good access to services, good access to schools, good access to green space, if you've got a job, all of these things are really fundamental to health. And health inequalities arise when people don't have equal access to those things. So coming back to the role of planning and all of that, well, obviously it's not going to solve it, but it can play a part. So for me, it's about how we use the opportunities coming through the Act to, I guess, to make sure that when we're developing our local development plans, that we're thinking about how they make sure that everyone in our local communities have equal access to those things that I talked about. So how do we ensure that the plans make sure that people have equal access to good quality housing? How do they make sure that they've got good quality access to public services that they require, good quality access to green space, to employment opportunities, and I guess opportunities just for people to come together and really feel engaged about or empowered about their local communities and feel empowered to make decisions about their local communities. So I think the planning system has a critical role to play in that.
I think I would add into that is that for planning, if we're reducing inequality, then there needs to be a focus on those areas of deprivation and putting some special effort into achieving all of that in order to reduce inequality. There's a need to actually give that priority within planning. And if we're sitting in planning not knowing exactly where those inequalities sit and where the priorities are, then that's when our community planning colleagues have that information. They have all of that profiling information there.
No, that's a really good point, Irene. That's why I was particularly keen to see that the Act introduced a requirement for planning authorities to do these health needs assessments, because that's exactly what that does. You know, it really helps them understand what are the real health needs of their local populations, including, you know, where the real inequalities are.
Okay, thank you. We had another question about how can we in public health engage effectively with planning departments given the multiple demands on their time. Well, as a planner who's worked in planning departments for 28 years, I would say one of the biggest things in planning that they could do with an expansion is around the evidence. Planning is an evidence-based activity, so local development plans will be based on what is the evidence there, what's the evidence on population growth and household growth, and that will guide the requirement to deliver more land for housing. But equally, it's having that kind of evidence around what are the actual needs in the area, how is the health of the population in the area going, what are the points where there's a problem, and highlighting what those are. If you can think about that, where I tracked it across to the impact on health, if we have an awareness of how a population in our area is doing, then that should track its way back to us realising where we could be doing more about that within planning. So I would encourage those in public health to be linking up with the evidence that they've got and the issues that they are dealing with, because there is an answer within planning and an emphasis that planning could be putting on addressing that. What do you think?
Yeah, no, I agree. I suppose for those maybe in the planning system that don't understand the public health system, so each of the local regional boards do have their own public health teams. I mean, they're fairly small, and obviously they've got a huge remit to cover all the bits of public health within the local patch. But there will be people, with public health expertise at a local level that you can engage with. And I guess from my experience, Irene, having spoken to planners, planners came into planning because they want to produce nice, healthy, sustainable places. So I think there's an absolutely a recognition amongst planners of the role that they play around public health. And equally, now within public health, as I was explaining, we in public health absolutely get the role that places play in health and health inequality. So I think there's a recognition on both sides. So I think there's a bit of an open door. And I guess it's just an encouragement, really, to reach out if you're in a local authority or if you're a local health board, just go and have a chat with your local planner or your local public health person, because I think there's definitely an appetite there to do more.
There's been reflections that in talking, I know certainly to planners, about not always knowing the relevant person to contact in their health board. For instance, when preparing a local development plan and not knowing who to send that plan on to, and especially not knowing who to contact in advance while you're actually doing the preparation, which is the more important time when you're preparing policy. So I know certainly in Public Health Wales, they are looking at having an identified person within Public Health Wales who is the contact, and you wonder if there's an opportunity there within both planning and public health to have the identified link, so that it is easier to know who to send your local development plan to, and then it's easier for the local health board and Public Health Scotland eventually to know who to contact within planning. So there's something we can still be learning all the time from our colleagues in the rest of the UK.
And just to follow up on that, Irene, when I was giving my presentation, I was talking about the focus on the new organisation to provide more support locally. So I think this is an area that is absolutely ripe for at least us to I guess maybe just pile it out and just start to think about how we as a national body, working with closely with our local public health teams, how we can provide better support to localities around planning. It just seems like a great opportunity to do some of that piloting.
There's a question sort of on the back of this. You're talking about how public sector and NHS work together. It's looking at how the private sector and development industry would engage with planners to find information out and help produce better places. So the question is asked, like, how are the development industry meant to engage with planning to help implement this change?
Well, the development industry already do engage with planning, both in the preparation of local development plans and then in the submission of planning applications. The element, I suppose, so there would be that input into the local development plan opportunity, and then there's also that element that's coming in through the Act about assessing health as it's coming through in a planning permission. Now, the opportunities where that has happened in Scotland are the likes of West Lothian, where it's the developer who's asked to do a health impact assessment, and then it's Lothian Health who review that assessment and make recommendations back to the planning authority. So you can see a loop there, and that's just an activity that they've set up themselves, but the introduction and the secondary legislation to follow will need to bottom out how that relationship works. So there are massive opportunities. There's also an awful lot of evidence on where a healthy environment is created and the kind of elements that we've been talking about today are included, then it actually makes for a better development, even for the developer, because it is helpful when it comes down to the actual if you get down to it, the monetary value of the area that they're creating and the return they get on their investment in the area, because people want to live in areas that have all of those things we're talking about, the local facilities, the access to public transport. That's the kind of thing that drives up values in areas across all of Scotland. We want that for all of the areas in Scotland now, to all have that kind of access and to everyone to be doing their utmost to achieve that. And that is in the interest of public sector and private sector to achieve that.
Yeah, so I guess from my perspective, I'm a public health professional, not a planner, so it's a kind of a new world for me. But I suppose we've got to recognise that private developers are there to make money, and that's their business, and that's quite right. I suppose what we're trying to do in public health is help them achieve that. So recognising that they absolutely, that is a driver to make as much money as they can, but they can do that in a way that has positive health outcomes. And at the moment we see far too many developments that look nice developments, but we know from an evidence base that they are not maximising their potential on health. So there are ways to maximise their income in terms of the number of units and the types of units they put on a bit of land, but to do so in a way that has maximum public health benefits. And that's the kind of win-win situation that I think we need to get to.
Okay, that leads into one of the other questions that was fed in, and people were looking up around, how can local development plan policies deliver the right levels and type and mix of homes? And it comes back again to looking at the evidence that we have. What is the type of housing that is needed in an area? We have an ageing population, and anecdotally, for the evidence that we've got at the moment, which anecdotal evidence is purely anecdotal, but it is around the fact that if we can actually show what is happening within the population, that we have an ageing population, that we have an issue perhaps with child poverty in the area, how is that translating through into what we are building right now? How is that impacting on not just the provision of affordable homes, which most housing developments will require, but is it the right affordable homes? Is it affordable homes for families, if that is what is needed in the area? If we have the right evidence to back that up, then there is the confidence to actually ask for that. And that flows through from if we have the evidence to back up the need for green space, to back up the need for active travel, then we have the confidence to require that when we are using our policies to actually determine any kind of application to make change of the use of land across our country, whether that be new development or regeneration. What will also help is if we have that requirement set out in the National Planning Framework, because that will now be forming the highest level of the the development plan that local development plans will be aligning with. So that will also help. Anything else coming through, Trevor?
Yep, we've had a question asking the appropriate venue for joining up these discussions within locality. Is this within locality planning or a new setup within councils? And are there any examples around this that you could show?
Given that Public Health Scotland hasn't actually even come on board yet and doesn't yet exist, a lot of what is happening around it can be sitting within community planning. But I would say to say where is it existing at the moment is that it's not. That's really what we are looking at. There isn't a desire to set up. I don't think there's a desire to set up anything new. We have an environment already. We have local health boards. We have community planning. We have planning. We have all that involves spatial planning, so transport and economic regeneration. And there's simply a need to pull that together. Now, for some, that is sitting within community planning, and they are doing that role. Where it isn't, it can sit wherever it wants to sit, but it will happen as an activity far more if we have the kind of foundation sitting there within Public Health Scotland being a statutory consultee. We'll move that forward so that then we'll have local health boards as well talking more to community planning and to planning authorities. So I'm less bothered about it having to have an actual authoritative place where it sits. We have 34 planning authorities, 32 councils. They're all going to do things in a different way. And that's why we need to look right now at the kind of national level of how we can enable that to happen, rather than saying that it's got to be in some new format or in some new place. We've got enough organisations there doing it. It's simply getting them to work together on doing it, really.
Yeah.
Okay, I'll go back to the list of questions that were fed in at the beginning around an interesting one actually about upskilling planning officers and decision makers on what constitutes good design for healthy places. Comes back really to the very beginning of our presentation, where as a planner myself, that's what I went and studied and got a degree was to do that, was to be upskilled in doing just that. That's not to say that there isn't a need to bring planners and public health practitioners together to realise their shared ambition, to realise the areas of work where they can actually help each other. At times, things like this can be seen as an additional thing on public sector workers who are already stretched and got a lot to do, but pulling together and seeing how we can actually support each other means that it doesn't absolutely need to mean an extra resource there to do this. It is simply linking up and having conversations on how we can support each other to do that. But Matt and I recognise that there's a need to do something more around that kind of network to help that and to help to upskill on each other's. And just the kind of topics that we've covered today and running the sort of webinar today is the beginning of that process. But we recognise that there's more to be done, isn't there?
Yeah, no, absolutely. I suppose, again, from a public health perspective, we now have so much good quality evidence of the role that good places plays in health and health inequalities. And I suppose it's just what's the best way for us to impart that evidence to our colleagues in planning. I guess the whole focus now on health coming through NPF4 and the Act, I guess, just gives us that wee bit extra momentum. So I think now, hopefully, our planning colleagues will be looking to see how where the opportunities are to learn about that evidence. And I think that will be a big role for Public Health Scotland as we go forward, is to be making that evidence available and feeding that into our planning colleagues as and when they need it. And I suppose, for me, that's really a question for our planning colleagues, I guess. So how would you like the information? What's the best way for you to get that information and access that information. So, we can put it on a website, we can come out and do some training events, we can produce resources, or a combination of all of that. So I think that's part of the discussions that Irene and myself and others will be having over the next month or so.
Okay, thank you.
I've got a question here regarding the input of public health and the maintenance and of existing places, rather than the input into new places where it's easy to see where a health impact assessment would come in. How would public health be seen as working with maintaining and restoring existing places which have negative health impacts?
Yeah, again, that's a good question. I guess it will be mixed. So I know from my experience that there's been a lot of joint work locally around housing and health. So, for example, local public health colleagues working very closely with their local housing colleagues to develop local housing strategies and making sure public health is embedded within those. Similarly, I mentioned the open space strategies. So again, that's, I think, an opportunity for local public health and national public health teams to work closely with local government to help develop these open space strategies. And those open space strategies are very much about how we maintain the existing green space that we've got, as opposed to developing new spaces. So I suppose it's just looking for those opportunities and just making the connections as and when they arrive. But I don't think it's particularly consistent, or there's kind of one size fits all. I think it's just different for each locality.
Yeah, I think we're so much at the moment focusing on getting that national level input and being very aware that it has to sit nationally and to fit for all 32 councils. But when you come down to the local aspect of an open space strategy, then that's where a public health colleague can again be informing on what are the priorities in this area when you're looking at your open space and you're looking at what is a valuable bit of open space that needs to be very much protected within any strategy. Then that can be informed by the experience and the evidence that is sitting within public health colleagues. And I've certainly been involved in open space strategies. I'm not been aware that we've actually gone and spoken to public health about those impacts of the availability of good quality open space on health and well-being, and how we need to not just protect it, but actually use change that's happening in our existing environment as an opportunity to enhance it as well.
I've got a question here on how progress or success would be evaluated with the work being done.
Well, that feeds into, at the moment, what we are doing. Matt ran through the fact that this is a whole systems approach that is ongoing within the public health reform aspect, which is very much about the fact that this isn't something that planning can solve on its own, or public health can solve on its own, or any organisation can sit and do on its own. It requires us all to get together and to work together on this, and to all have our individual inputs, and to see where, as I was saying, we can help more. So as part of that, it links very much with those of you who may be aware of the place principle, which asks people to work together around their services and their assets to deliver really good outcomes for people in a place. Well, similarly, the whole systems approach is about doing that. And it's begun by identifying early adopters across Scotland who are looking at just starting to guide that work and to look more broadly around that whole system, and are looking at a framework of how do we then capture that learning, because the idea within those kind of almost pilots of working together will be that we capture the learning so that we can disseminate that and spread that out amongst others. As for actually measuring it, I suppose I was chatting with Matt before we came online today, and I was saying my ultimate measure would be that things like hospital waiting lists and doctor surgery lists are going down, but that's not because we're having to spend millions and millions more on the NHS, but because we're all living healthier lives. That would be the ultimate, and it would be those daily outputs that we have of evidence of how ill people are and how many visits they're making to doctors and to A&E units that should actually start to go down. That's the ultimate measure of success. What do you think?
Yeah, no, I agree entirely, Irene. I mean, obviously that's very long term, but ultimately that has to be what we're aiming for, and it goes back to what I was saying about the unsustainability of NHS services. So that's exactly why public health reform is going through that process. I suppose there's a couple of things from me. So each of the public health priorities, so as to remind you, there's 6 public health priorities. So the first one is around places and communities. So each one of those are being mapped to the National Performance Framework. So there's a work ongoing at the moment to map those public health priorities to the National Performance Framework, which, as you'll all, I'm sure, be aware, the National Performance Framework has these national outcomes, and there are indicators that sit within the NPF. So immediately we should have some kind of process to be able to at least get an indication as to whether things are changing the way we want them to change through the National Performance Framework. The second, I suppose, point is that Public Health Scotland and subsequently Public Health Scotland has a role for doing fairly big, large-scale evaluations of national policy. So, for example, Health Scotland leads on the evaluation of Scotland's alcohol strategy. So when you see in the telly all these figures about, drinking's gone down since minimum units pricing, Health Scotland sits behind that evaluation. So we are, again, talking with our colleagues in the evaluation team about how we might choose or how we might measure the impact of the Planning Act. So it's something that we're actively looking at.
So that's something that will involve working across with planning
Absolutely.
as well and getting that evidence. Okay. One of the questions that I've read in also is interesting because it's asking about embedding health in all policies. The input that we've had into the group of us that have been working on this so far has been a representative from Heads of Planning Scotland, but it's been a representative who has a local development plan that does have a health in all policies approach. So that has particularly helped us, and it's certainly something, if we're looking at local development plans, taking more account of health impacts as we move forward into secondary legislation, then there's further work for ourselves on our journey to do around establishing that health in all policies. Do you want to say a little bit more about?
Yeah, so I mean, for those who are unaware, I mean, the whole aspiration between health in all policies is really, as the name suggests, it's recognising that if we really do, or if we are serious about tackling the health challenges, then pretty well every government policy potentially has a role to play or has an impact. So if you look at transport policy or environment policy or education policy or whatever, they all have a role to play. So health in all policies is about recognising, or it's about how we make sure that those policies are written and developed in a way that has those health outcomes. So that, again, is a big bit of what Public Health Scotland does or will do. So it's about how we work closely, and we do work closely with our policy colleagues in government to help them develop and design policies that have the impact on health outcomes. And that's why we're delighted to see the focus on health in the Planning Act. So that's a really good example of health in all policies. So it's I mean, it's a good question. It's absolutely something that we recognise and is fundamental to really addressing the key challenge.
So just for information on that, it's Glasgow Local Development Plan that have established a health in all policies approach. But our understanding is that Aberdeen City Plan is also working towards bringing one out that certainly puts public health at the heart of its policies as well. So again, across the whole of Scotland, there'll be different approaches to doing it, but the theme of health in all policies is established far further than purely in planning. It's a well-established means of achieving public health and realising and recognising that everything that we're doing is ultimately about the health and well-being of the community of Scotland. And on that seems like a good point to conclude today to thank you for your time and for your questions, and to let you know that we will indeed be following up, and we will let you to. The reason that I've put down at the bottom of that final slide there, our different Twitter accounts, is I encourage you, if you want to keep in touch, to follow on Twitter what is happening, what that research and evidence is. I certainly, on my own Twitter account for the Improvement Service, if I find any research and evidence, you can be sure I'm constantly tweeting about it. So it's a great way of building up a bit more knowledge to inform what is ultimately they've got to be your own conversations moving forward with this, and your own input into both the Planning Act and how it's implemented, and into Public Health Scotland as it moves forward. So I thank everybody, thank Matt and Trevor, and thanks very much.
Thank you. Just to let the audience know that we will be sending out an email afterwards with an update and a link to the recording if you wish to share it with any colleagues. And thank you and goodbye.